Margate Task Force is a co-located integrated team. It was conceived about 4.5 years ago. The idea really came from the local authority, the police, the fire service, sort of knowing the area and some of the problems it was having with the local communities, be it both local population as well as the migrant communities coming into Cliftonville and Margate. And pretty much with that concept we thought, okay, what's the best thing to do? And that was really to bring a team together of all the key agencies to actually work together as a collaborative party and share information, which is fantastic for us because we do a thing called talking and we actually share vital information for the vulnerable communities out there.
It was decided that there was a lot of frequent callers to the 999 system, and also that a small percentage of those people were suffering with mental health issues and thus having a very disproportionate effect on the 999 system, not just for the police but for the ambulance service as well, and also subsequent A&E admissions.
Because we've got about 14, 15 different agencies in the team all connected to their respective systems, we had a conversation around which callers were resulting in the highest demand for us. That put us in a really strong position because within the office environment set up as a meeting, we're able to exchange information.
A person is known to the mental health service, so they will have a care coordinator. I will go to the care coordinator and I will discuss the situation with them, tell them the concerns that are being raised by the frequent calls. And then there's several options. The care coordinator can link in with the police. I will go out with the police officer and we will pay a visit to these clients. We will go down and we'll initially on our visit we'll ask them what concerns they have, and we understand that they have been ringing the emergency services on a regular basis, and ask them what their problems were and if we could help support them to find out what the issues were to remedy the situation.
We've certainly noticed that although we're still getting the same people phoning up, as opposed to making in excess of 20 plus calls a month, that number has significantly reduced. Sometimes to the point where they haven't phoned us in quite a number of months because they're engaging with the mental health teams, with any substance misuse teams, and they're getting the support and the care that they need.
I think the outcomes for us, as we're finding our way through and negotiating what is a difficult process when you're looking at lots of different agencies, having those conversations together, is the emerging quality leads to discussions around how we can safeguard the client and address their needs more effectively and better protect them from harm, and better support them jointly in terms of the wraparound service provided to them, but at the same time reducing our demands on the respective services.
We're able to identify people earlier in their stage of mental health crisis and able to give them the support that they need before actually they enter crisis.
What it also enables us to do when we're sat around the table in that way is better understand the perceptions of each of the agencies and having really good, healthy, productive conversations about the role that each of us will play in dealing with that high demand client. And what that has led to is better understanding of the needs of each of the agencies.
It's helped with the patients because they're not being detained in a cell because there's no mental health provision for them anywhere else. And it's also meant a much more coordinated approach between the mental health and the police, where before there was perhaps a bit of reticence and a misunderstanding of their business as usual models. So with talking together and being in the same office all the time, it's negated time and finance and overall better picture for everybody involved, including the mental health patient.
I believe that we now, through the joint working, we have a far better understanding of how each service works. I have got more understanding into the difficulties that the police experience, and the police now have understanding of the experience that social services, adult mental health experience.
Information sharing within the task force plays an important role because it's fundamental to the core business that we do within the community.